Windy City After Dark, and earlier in the show you saw Dr. Drai. He is back now, America's OBGYN. And so you told us all of the 20 things, or we went through some of them, that you should know about your V. Now you have sparked up so much interest on social media. There's a ton of questions for you.
I feel like I get yeast infections more often than normal, like almost every 2 months. Is something wrong down there? By the way, all of this is anonymous, and I'm not asking this question, so go ahead.
The first thing I would say is, gynae girl, you need to pee after sex. Very, very important.
And
you need
before.
To pee. And before. Girl, I like you, Val. Yes ma'am, honey. She let me have it. Read. That was a dirty old read. I like it. And before. I love you. Yes, you know how it is. Like when you orgasm, you know, sometimes stuff gets in there. But you women, us girls have to pee so everything comes out, or you can get an infection, like a yeast infection or smelly odor.
Okay, Dr. Drai, what advice do you have for teenagers with extremely painful cycles, but they can't use birth control pills?
Oh, wow, that's a tough one. Actually, you could just use Motrin. Motrin.
But wait, do birth control pills stop?
They help sometimes. They make it a little lighter.
Oh, do they?
Yeah, they control. They shut down the ovaries, so the pill actually controls your cycle, so it makes everything a little better.
Oh,
but if you can't take it, just try Motrin for pain.
Okay.
I'm learning all kinds of stuff, guys.
Ryan loves it. Ryan loves it.
Okay, my friends think it's weird that I sleep with a tampon in. I change it right before bed and right when I wake up. Is this okay?
Okay, so everyone should know this, okay? Pads at night, tampons during the day, right? So you don't want to go to sleep with a tampon in because sometimes you're going to forget. And then they can stay in for months, and you come to my office and I smell something and I pull it out and I'll say, girl, what are you doing?
Is this a common occurrence?
Common. I'll probably take out tampons maybe like once a month.
Really?
Tampons and condoms, actually. Broken condoms.
Oh.
Yeah.
I mean, I like the fact that you're using condoms, but pay attention.
Right. Okay. So women actually forget.
They forget, yeah. So busy moms, you know, you're super busy. You know, you're like taking care of your husband. You're taking care of your kids. You're forgetful. You're stressed out.
Come on, doctor. You can't forget that.
No,
what do you know, Ryan?
Apparently not. I don't know. I didn't read the doctor manual on that.
I mean, he's not saying once a day, but once a month getting a case like that. I can see that.
Yeah, absolutely.
Okay, well, I'm a 25-year-old virgin. I feel silly asking this, but I feel perfectly healthy down there. When would you recommend for ladies to begin seeing an OBGYN, even if they're not having sex?
Oh, well, you should see one. Even you don't have to have sex to see an OBGYN.
Dr. Drai?
Oh, sorry.
Dr. Bowles in the house.
Sorry. Yeah, that's just female health down there. I mean, you don't have to be having sex.
And how often?
Okay, go.
Exactly. 21. Age 21, you should get your first pap smear, even if you're a virgin.
I'm 43.
Ryan's like
curious.
And until recently, I've had normal periods exactly 28 days. The last few months have been weird, though. I've skipped a month here and there. When I got my period a week ago, it was very light, about 1.5 days. Could this be the beginning of menopause?
So it could be, but gynae girl, just remember, you're going to go into menopause. You're going to follow your mother's pattern. So I always ask your mom, when does she go through the change? And you're likely going to follow her pattern. But she's probably super stressed out. So any kind of stress will change your period. So have more sex, go out with your husband on a date or wife on your date, and let someone else keep your kids on the weekend.
Okay, all right.
Have regular.
Oh my goodness.
Is that it, Jim?
Well, you know, one more question just about dryness. Dryness causes. What do you do with it?
Well, dryness, I mean, you can use lubricant, obviously, water-based lubricant. But why is your vagina dry? That's the first question.
Like
so orgasms with women, it's all up here, Ryan. Up here, man. Up here.
True.
It's all up here. It's, you know, it's not like men. You touch it, it's like, you know.
Right.
It's all up here. So, you know, if you can't, you know, make love to her brain, then her vagina isn't going to work, and it's going to be dry. And
is that the only reason that women are dry?
No, you know, menopause as well. Like when you don't have enough estrogen from your ovaries, you can have a dry vagina.
You can get some estrogen supplements, right?
Well, if you don't have any like risk of breast cancer and all that kind of stuff.
Okay.
But let's try lubricants first, water-based lubricants, and go to couples therapy.
Couples therapy. It sounds like you might could give some couples therapy.
Honey, yes, ma'am. That's all I do. Gay gynecologist. Hello. Most of the time, it's just counseling sessions.
Thank you. Thanks for being here, buddy. Thanks for watching Windy City After Dark. We're going to see you at 11 a.m.